Welcome to the Holistic Health Show, where the worlds of science and spirituality converge to illuminate a path towards total well-being. Join us as we embark on a journey to bridge the gap between Western medicine and complementary therapies, offering you a roadmap to embrace a proactive, holistic approach to your health. It's time to empower yourself with choices that nurture your body, mind, and soul. Welcome to a world of infinite possibilities for your optimal health. Hello, everyone. Welcome back to the show. Today we have Amanda Lewis joining us from the States. I'm very excited to have you on the show today. Now, Amanda, you are from Vivacious Women's Wellness. It's your own business, which is very exciting. And you're a nurse practitioner. And today we're actually going to discuss something we've not discussed on the show before. And that's women's health and sexual wellness.
Yes, I'm
Awesome.
very excited. So thank you for inviting me on the show. As you can hear, I am from the southern part of the States. So I'm from the deep South. That's Louisiana, Mississippi area. So most people, if you don't know the States, you at least know New Orleans. Okay. So I'm about 45 minutes north of New Orleans, between Baton Rouge and New Orleans. But my business is in Baton Rouge. So I like to kind of explain what I have done in the past and kind of what led me here. I started off as a nurse and I've always loved labor and delivery, but it was hard to get into. Eventually got into labor and delivery, had a bunch of crazy stories before that, but that's another day. So finally got into labor and delivery, and the place that I was working here did not have midwives. So I was working with OBGYNs, and I realized that, oh, I don't like this. It can be so much better. So then I found another place in Baton Rouge that did have midwives, and I moved over there as a labor and delivery nurse, worked there for a little while, and then decided I have to be a midwife, a certified nurse midwife, which is a nurse practitioner. So here in Louisiana and in the States, is a difference in midwifery than it is in other places. So we have two different types of midwives here: certified professional midwives, which basically do home birth and birth center birth. And then we have certified nurse midwives that take care of women throughout their entire lifespan. So that's going to be from, abnormal periods from the teenager all the way through pregnancy, childbirth, menopause, and beyond. So my scope as a certified nurse midwife is very different. It's a lot more things that I do than a certified professional midwife. And so I started off my career as a traditional certified nurse midwife in a hospital setting. It was a wonderful experience. I got to experience low risk and high risk births. We did water births. We did twins. And I mean, it was just beautiful. But we also did a lot of high risk stuff, and my skills were really good, but my heart just wasn't in it. So I moved over to the birth center of Baton Rouge, and that is an out of hospital birth center. And I worked there for several years. I was the clinical director. But I really had, as I started to age, and I heard so many women coming in for their annual exams, kind of complaining about the same things, I started to become more interested in sexual health. Because when you go to your traditional annual exam, do you have anybody ask you, hey, are you having painful sex? Are you having good sex? Most people don't ask about that. But it's a very important part of a woman's life, especially in a long-term relationship. So I wanted to make sure that we talked about it. So I started training myself in it. And I looked for all the resources around here and realized there really aren't many resources. I learned to do the O shot, which is another name for the orgasm shot. That is PRP, platelet-rich plasma, that we inject into the clitoris and the G-spot. And it's a non-hormonal alternative to help with lubrication and help with increased sensitivity of the clitoris. And I can talk more about that later. But that's where I kind of started. Of course, I had been talking to women about this for a long time. But as far as procedures and learning different things that you can do, I became friends with pelvic floor physical therapists here in town and went to them and had them teach me, how do y'all do your exams? So you can figure out, is this a muscle thing? Is this a nerve issue? So I trained myself that way. And then I became a member of several organizations. I have a lot of organizations that I'm a member of, but one of my favorites is ISWITCH. So it's the International Society for the Study of Women's Sexual Health. And it is a wonderful resource. The only thing that they're worried about is women's sexual health. So there's just a wealth of information. Now, of course, we've been doing male sexual health forever. I mean, how long has Viagra been around, right? But of course, we're behind the ball for women. So I'm very excited that women are, finally getting research done and medications approved and techniques that are approved just for them. So with all of this knowledge that I started gaining, I decided to open up my own place. And I did not just want to do sexual health. I wanted to help women through the middle part of their life. So I call myself the midwife for midlife. And that is during that really difficult time when you're hitting perimenopause or you're going through menopause, your your parents are aging, your children are teenagers, you're at a higher level in your job, and you just have so much stress. It is one of the most difficult times in our lives, that fourth and fifth decade of our life. So I love to help women through that. So my place that I opened is Vivacious Women's Wellness, and it's holistic healthcare for women. And I focus on hormones, sexual health, and weight loss. And I do that for all the clients that walk in my door. Some women just come to me for initially for sexual health, but then once they're there, they realize, oh, you can help with that and that and that. So it is a wonderful process to get to see women go from when they come in, they're stressed out. They can't even remember the last time they had good sex. They are exhausted. They can't get rid of this belly fat. And then at the end of the 16 weeks that I'm working with them, or, some people end up doing 2 sessions, they're eating better. They're sleeping better. They're having good sex again. It's just wonderful to see these women blossom.
That must be incredibly rewarding.
It
And I
is.
mean, yeah. And I mean, as I sit here, and anybody who watches the show regularly will know that I get thinking, because some of these
Yeah.
topics are so new to me.
Yeah.
And saying that with the topic being women's health and women's, sexual health, I have an awareness of my own health and general health.
Mhm.
But when you mentioned, Viagra's been around for a long time. We've been talking about men's health for a long time. It's, kind of been shoved in our faces.
I mean, you see the
And
commercials all the time. I mean,
mm,
they're even on when my children's stuff is on. And I'm like, oh,
yeah,
I don't want you to see,
it's so
the
unnecessary.
man getting excited about Viagra. Like,
Yeah.
yeah, it's unnecessary.
And Viagra's great, right? I mean,
Y-
that's
Yeah.
fine. But it's not to tout Viagra itself. It's just the fact that it's there and women's, sexual health isn't. And so that brings me back to I don't think I've ever, as a 37-year-old woman, been asked by any health professional what my sex life is like.
Really?
Yeah,
I'm
and
so
and I
sorry.
think when you think sex, you think, well, why would they be asking you what your sex life is like? Well, it's like because it's not just the act of sex, is it?
Well, specifically for me, so for my intake form, when you see me as a client, I screen you for hormone deficiencies. I have like this symptom tracker. I also screen you for anxiety, screen you for depression, and then screen you for sexual distress. So there's something
Mm,
called the Female Sexual Distress Survey. So some women don't have good sex, but it doesn't matter to them. Like
mm,
sex is not important to them. It's not important to their partner. Like it's a functional thing. So on this little thing, it says like in the past, I think it's in the past month, it's 16 questions. And if you score more than 11, it indicates that your your sexual like your sexual experience, it does distress you. Not as
mm.
in it's painful, although that's part of it, but it's something that I want to improve. So
Yeah,
for
it
my
matters.
annual exams, I started asking women about their sexual health years and years ago.
Mm,
And when I started asking them, people were like, no one's ever asked me that. And it just felt like it opened the floodgates. And they
yeah.
started telling me, and I cannot explain to you, Amy, how many times I am the first person they've told that they were assaulted. you know,
Yeah.
or they were molested as a child, or, I've been having sex with my husband forever, but it's always hurt. So
Yeah.
the thing is, it doesn't have to hurt. The holistic part of what I do is I'm not trying to say that I can fix everything, but
Mm.
I've had a lot of connections in this town because I worked here for a long time. So if I do a pelvic exam and I find that these women have very tender areas that they need a pelvic floor therapist, I can refer you to them. If you need help with some sexual trauma, I have therapists for that. If you need a sex therapist for you and your husband because of some things going on, I have people for that. I was telling you about, so I have a woman who has a grade 1 uterine prolapse. So she told me that sometimes she has pain with sex. Well, as soon as I did her exam, I said, well, I know why you have pain with sex. And she said, well, what do you mean? I said, well, your uterus is sitting a little bit lower. So that's causing your cervix to sit lower in your vagina. So direct thrusting is going to hurt your cervix. I said, so you're going to have to so we looked up different positions that she could get in, but the best thing for her is called the O nut. And it's OHNUT. And it's like a little donut vibrating thing that he puts on his penis. So he can go ahead and thrust and thrust and thrust, but it gives him a spacer. So he's not going as deep. So she can enjoy it more because he's not just beating the hell out of her cervix every time,
Yeah.
So there are things that we can do to help improve your sex life. Many women really don't have much of a libido, like they have a very low desire for sex during that perimenopause and menopausal period because their hormones are really low. And perimenopause, it tends to be a time of estrogen dominance. So your estrogen, it goes a little wacky, kind of like it does when you first start your period. You have like these irregular cycles. They're a little heavy and you can have these mood swings. So we usually try to balance that by adding progesterone and then looking at the other things in your environment that can be increasing or affecting your estrogen. And that's part of that holistic thing. If you're not sleeping well and you're not eating well, it doesn't matter how much estrogen I give you, or I'm sorry,
Yeah.
progesterone that I give you. So the holistic part of what I do is I look at your entire life. Hey, what's your husband's name? How long y'all been together? How'd y'all meet? How's your relationship? How many kids do you have? Are they driving you crazy? Is your mother-in-law driving you crazy, or your mom? And what about work? Are you happy at work? And we talk about this every single week. And I help walk them through life and making decisions and how to give themselves more bandwidth by sleeping better, by eating healthier, by eventually starting to add exercise to that for stress relief and for their bone health. So I don't have them exercising to lose weight. I have them exercising for stress relief or, doing weights to help them not have osteoporosis and be that little cow, the little old
Yeah.
lady that gets all bent over. So that's kind of what I do and what I talk about.
Almost sounds like a girl's best friend, It's just
Well, it
'cause
really feels like we're friends by the end of it because, again, we're seeing each other every single week. It almost feels like at the end of the 16 weeks, if we don't do the maintenance where I see them once a month, at that point, I feel like I'm kind of missing a friend. But it's really just nice to have someone to walk through it with you that doesn't know
Yeah.
you, that doesn't know your family, that you can just be honest with about anything.
Yeah, and I mean, just having that conversation, like you said, about opening the doors to, hey, you know what, I'm here to talk to you about
Yeah.
sexual health and to help you learn what's normal and what's not. Because,
Yes.
if you don't have a close relationship with anyone that you're comfortable having private and intimate conversations with,
Yes.
then when do you learn, Like I know myself, I don't know anything about menopause. Nothing,
Hmm.
right? And I don't know anything about IVF. Like I'm completely, I don't know
Yeah.
anything about pregnancy really because I
Yeah.
don't have children. It's
Yeah.
not I haven't lived it. And when I
Yeah.
talk to my friends, who have been pregnant, I don't think it's intentional, but I feel like nobody ever tells me how it actually is because I don't think it's as great as some people say.
I
Because
will be honest with you about it. Sometimes it's good and sometimes it's
yeah.
not.
And I've, as a paramedic in a past life, I've delivered
Hmm.
children and I've attended to women who have been pregnant and had complications. So I've seen that side of it. And that side
Hmm.
of it, from my point of view, particularly because it's an emergency setting in most
It's
cases.
terrifying.
Yeah, it's scary. So I'm
Yes.
like, you guys keep saying this is friggin' fantastic,
Well,
but
you know, Amy, I will tell you, I've had so many people. So I still deliver babies as well. I just do it PRN, which means as needed. So I just do maybe from 1 to 3 shifts a month just because I love delivering babies. Well, I call it catching babies because you deliver a pizza, you don't deliver a baby. That's just a little technicality, but the mamas do all the work. I'm just the one that catches. Okay.
yeah,
But
absolutely.
when there's complications, I know how to get in there and do what I got to do to get a
Mhm.
kid out. However, when you only see the bad, I will never forget. I had one mom, it was a young couple, and her mom she was like a nurse manager or DON, director of nursing at one of the hospitals here, but it was a children's hospital. So the only thing she saw was the bad babies that came in like with infections or came in with severe jaundice. So her whole perspective was skewed. She didn't think that she wasn't in that normal birth space, in that normal, like when everything goes right, which most of the time it does. And if you don't see the normal and all you see is the abnormal, of course, you're going to have a very skewed perspective of what birth is. And it can be terrifying. So, birth is one of those things pregnancy, childbirth, postpartum, all of that is really good when it works. But when it doesn't, it can get bad really quickly. And that's why you want to make sure that you have someone that is skilled.
So I'll just kind of just pop back and bring us back to how I was saying how uneducated I am about women's health, despite being a 37-year-old woman, and about my friends kind of and just people talking about pregnancy. And I think part of it is, and maybe I'm wrong, but I think part of it is you just forget, or you want to forget, so that you'll kind of do it again, or don't live through that maybe traumatic time
Yes.
or something. But even like, menopause, people kind of say, "Oh, I wish I had a known." And it's like, well, why don't we start talking about it so everybody does know? And then I'm seeing, so I recently started IVF and egg harvesting, and we've just completed an embryo transfer. And I know a lot of people who do it, but no one in my real or have done it, but no one in my really close circle has. Um, so I've never had the opportunity to talk to somebody about what it looks like, what it feels like.
Yes.
I knew there were needles, I knew there were hormones, but outside of that, I really didn't know. And I asked the nurses, and they were lovely. And you think you're getting great care, and I did. I felt very safe through the whole process. And I remember saying to the nurse, "So how am I going to feel taking these injections?" And the needle thing didn't bother me.
Yeah.
I got over that. That's fine. I didn't know that there would be things that I would have to insert vaginally. I had no idea about that. Medications that would have to, and for weeks, I'd have to do this.
Yeah.
And which again, it doesn't bother me, but I just had, they sent me to the pharmacy, and I came home with this huge bag, and I sent a picture to my husband. I was like, this is everything that I have to take for the next almost month.
I don't know if my body will take all of this. Yeah.
And
Yeah.
then I felt horrible. And the nurse
Mhm.
said to me, "No, you won't really, you'll be fine." I said, "Oh, well, this is news to me, because I know that just when I have my period and my hormones go crazy, I feel like a
Yeah.
mess. So, okay, but I'm okay. If you say I'm going to be fine, this is your,
Mhm.
your thing." I did not feel fine. Emotionally, I was fine. Physically,
Physically.
I felt horrible.
Yeah.
I felt horrible. I hurt. I had a headache that didn't go away for almost 2 weeks the whole time I was taking the injections.
Mhm.
I ached. I was exhausted. I slept, and I'm a bit of I like sleep anyway. I'm
Mhm.
like a 8 or 9 hours a night kind of
Yeah.
person. Like, that's my optimal. But I couldn't get up in the morning, and not because I
Wow.
felt sad or depressed, because
No.
I
No.
was exhausted.
Yeah.
And I'm very
Because your
lucky to
body
have a
was your body was doing a lot of stuff. But if you
and
don't
here this
understand
nurse
that,
just said, "No,
yeah.
you should feel fine." And I'm thinking, why wasn't I better prepared, And what if I didn't have the flexible working space that I have? Because I was
Yep.
napping every afternoon. There was a
Mhm.
couple of days when I think I was awake for all of 3 hours. And I'm not saying, and this is not to, to intimidate anybody who hasn't done IVF and is planning to. This was my experience. And I'm sure there are women who have worse or better experiences than me. But I guess the reason why I'm sharing my personal experience is because nobody told me. And I don't
Yeah.
understand why we don't talk about it. why don't why do people always wish they knew? Why
I
don't we
don't,
share?
well, I don't really know. And it's really sad that we don't talk about these things. So to me, perimenopause and menopause, they are these huge life changes that women go through. And I know that my mom didn't tell me about it. Her
Mhm.
mother didn't tell her about it. If I'm lucky because I have some friends that are older than me. So they had
Mm.
kind of said, oh, wait, just wait. You'll know.
Mm.
And I am only 40, but I started having those night sweats this year. And I'm
Yeah.
waking up thinking, do I have a fever? What is wrong with
Mm.
me? And then the mood swings and some of these other things. And then my mother had a hysterectomy. So I don't know when she would have gone through natural menopause, right?
Right.
So I was kind of talking about it a little bit earlier, but in perimenopause, your estrogen becomes very dominant. You just don't have enough progesterone to balance out. Sometimes your estrogen levels are really high, sometimes they're low. It's kind of like a roller coaster ride, but they tend to be the much more dominant hormone. Progesterone, we call nature's Valium, usually helps to balance that part of it out. But when you have the levels going really high, sometimes it can't balance that out. And then often our testosterone just drops. So women always have testosterone. So a lot of people don't know that. And men have estrogen. Okay.
Yeah.
So it is a balance in our bodies that we need to maintain. So estrogen, when you finally run out of it completely, that's when you're going through menopause. Once your periods stop, you start to have those mood swings. You will have hot flashes that you just cannot stand. Like the whole room is cold and you feel like you're in the pits of hell
Well,
and you
yeah.
cannot calm down. The night sweats. Then you also there's something called genitourinary symptoms of menopause. So that's when the labia and the vulva right there, they will start to atrophy or shrink. The clitoris will
Oh.
start to shrink and shrivel up. Your tissue becomes very friable, which means that it's very easy to tear or bleed or become irritated. Vaginal lubrication is a thing of the past. You feel like it's a Sahara desert
Wow.
down there. And all of this can be fixed with hormones. Now, I do have some things that are not hormones that you can use to fix it, but so many people are scared of hormones because of cancer risks. But
Mm.
when you're looking at estrogen in the vagina and like an estrus cream just on that vulva area, those are not getting in your bloodstream to the point where it's going to affect you for breast cancer. Now,
Yeah.
I check every single person for their history of breast cancer in their family. If they have a significant breast cancer history, there's some amazing genetic testing that we can do to find out about your specific risk. So, a lot of what I do is personalized medicine. So, if you have this family history, I'm not just going to try to give you estrogen. We're going to go through and look at your risks and benefits, and then we do shared decision making. But almost every single woman can use that vaginal or vulvar estrogen without having an increased risk of breast cancer. And that is a wonderful thing to use, and it will help your sex life so much because sometimes no, it doesn't matter how much lube, if you get all this friction over and over again, it's going to tear and there's bleeding and there's pain. You're
Mm.
crying. He's feeling like he just like cut you to pieces, you know? And then your testosterone, the reason that you want to help replace that, it's your libido, but not just your libido. It also is your muscle mass. It helps with depression and energy levels. So men tend to have this drop in their late 30s or to mid 40s. And you will see men, they really can use testosterone therapy as well to help them not just with their libido, but also with that muscle mass, depression, and your energy level. Okay. So all of these hormones, when you have a practitioner who you know you can trust, who will do the appropriate blood work and make sure that it's safe for you to take hormones, it can help make this transition period so much easier. It's not even fair that women should have to go through this without hormones, if they are a safe candidate for them.
And some of those symptoms that you mentioned, like I feel like these are the things that we should know about. We should be
Mhm.
prepared for.
Yeah.
And again, going back to kind of, because as I'm aging and I'm noticing my body's changing, and you look stuff up and it just becomes overwhelming, you
It
know?
does.
Okay, and there's so much contradictory information
Yes. I
on
know.
even like how much of what you should have, and at what
Yes.
age you should have it. Because, and again, the age is, it's a bit of a spectrum, isn't it? Because everyone's so
Yes. I
different.
mean, we have women having children in their 40s now all the
Mm,
time. I mean,
yeah.
I think that Janet Jackson had one at 50. So
Wow.
I actually had a woman in my practice who was 50 years old and pregnant, and she was
Wow.
mad about it. So
Yeah.
those change of life babies are a real thing, you know.
Yeah.
But I think especially as you know, our generation, a lot of them put off having children and for, you know, different reasons. So it's not unusual to have babies in your 30s and 40s now. It's actually pretty
Absolutely.
normal.
Yeah, absolutely. I think we are definitely getting older, and in doing hitting these kind of milestones,
Hmm.
I suppose. And I often wonder too, is that why there's such, and I mean, maybe there's not an increase in it. Maybe it's because it's more available. I'm not sure. But a lot of people I know, and like I said, I don't have intimate conversations with them about this, but I know plenty of women around my age who've had all of their children through
Hmm.
IVF. And I can't help but wonder if that's because, like, we're 40 now, you know?
So I
And
will tell you with IVF, once you are over 35, you have increased risk of certain chromosomal conditions, but also you want to make sure, I think that a lot of women do IVF because they want to make sure that the quality of egg that they use, like, is good, you know, because when you're born, so I have an interesting thing. When I was pregnant with my daughter, the eggs for my grandchildren were already inside of her.
Mm,
Isn't that an interesting
yeah.
concept to think that while she was inside of me, my grandchildren were also inside of me? You
Yeah.
know, I think it's just
Yeah,
an
I've heard
interesting
that
concept, but
before. It's beautiful, really.
it's a beautiful thing.
Mhm,
Like you have all the eggs you're going to have, you know, when you're
mhm,
born. And I mean, we don't need them for a long time. So we
yeah,
don't use them. And then, you know, but once we get in our late 30s or early 40s, you do have less eggs. And
yeah,
then and not all the eggs are good quality either, you know?
yeah,
So that's why some women will have miscarriages and they're like, I just don't know why.
mm,
When you have a miscarriage early in the first trimester, I think, I can't remember the source, but 80% of those or something genetic just didn't mix right. Like
yeah,
something just was not right. And it never would have, you know, created life.
mm,
So I think of sometimes those early miscarriages as almost like a blessing because
yeah,
the child never would have been formed properly. But so even though we have all the eggs we're going to have when we're born, not all of those eggs are really great. So I think that some women just want to make sure that the quality of egg that they're
sure.
using is good. And it's not always the women who have difficulty. Sometimes, you know, you have to do IVF because the man didn't have like his sperm or wonky, or, you know, you have to, or they're not mobile or something. They have when you look at sperm analysis, the terminology is pretty funny sometimes.
Yeah, they were, because I ask a lot of questions,
Yeah.
and as in the example of not being told I wasn't going to have any symptoms, I don't always maybe get all the
Yeah.
answers, but they had tested my husband as well when we were going through this process, and it
Hmm.
was, sperm count, and are they too
Hmm.
big or are they too small, and are they
The
too fast or are
morphology
they
of
too
sperm.
slow?
And then you're
There was a
Googling,
lot.
like, what does this
Yeah,
mean?
I had to get off the computer because it just
Yes.
was a rabbit hole,
You
and it's
you can
yeah.
definitely go down some rabbit holes. That's why I
Mm,
like to find good support groups in the area. So we've been very blessed. We have a support group in our area for infertility, for women who lost babies, for women who are pregnant, and different places. So it's really good to kind of connect with those other women who have gone through it already, or they're
mm.
going through it with you, so they can understand. Like the nurse told me that too, but look, this is how I feel.
Yeah, you
And
don't
it
feel
might have just been
alone.
if the nurse was trying to be kind and just, or she could have just been ignorant. You know, she might not
Yeah,
really know if she's never gone through it herself.
yeah, absolutely. You
And
don't have everyone's experience, so.
yeah, yeah.
Hmm. I'd love to hear a little bit more so about, the hormones that
Mhm.
you offer to help women who are going through these stages of life. And I'd also like to know, I mean, maybe I'm ignorant. Maybe there's all sorts of this around me and I've just never, sought it out. But when I see my doctor, I definitely don't get asked these questions. So, in your area or anywhere else around the world, are you aware of many women doing the same sort of work that you're doing?
So in my area, we probably have. So as far as hormone clinics, you'll find hormone clinics everywhere, to be honest with you, in most big cities. Some of them are more, you just stop in, get your blood work, they send you your stuff, and you'll see them again in 3 months. And that's
Yeah.
the standard. The same thing for men's clinics as well. And I will tell you, I don't treat many men. The only men that I treat are partners of my current clients.
Yeah.
So if they suspect anything, because it doesn't do me any good to get her libido up and stuff if he's struggling over there.
Yeah.
So I try to, like, one of my passions is those long-term couples, because,
Mhm.
if you've been with somebody for 20 years and I have been with my husband for 20 years, you're like, hey, we might want to see if everything's okay.
Yeah.
Anyway, but what I do is different because I don't see anyone else specializing in the sexual health portion of it, or really doing that holistic portion. And I think it's because
Yeah.
I'm a midwife. So again, I'm a nurse practitioner, but I'm also a midwife. And I've come from that holistic background my whole career. So I always got in trouble for talking with my patients too much. I always got in trouble for taking too long with my patients, because I truly care about what they're saying. I care
It's taking
about,
that
and I want to
time.
hear,
Mm.
and I will say medicine here in the States, and I'm not sure everywhere, is not set up for success for providers to be good clinicians. You can still be a good clinician, but you just can't develop that relationship if you're having to see a patient every 15 minutes
Yeah.
to make sure that you meet your quota to get what the insurance will pay you. That's why I don't work with insurance companies. When
Mhm.
you are coming from a place of wellness, so I'm trying to bring them to a place of wellness and their very best version of themselves. Insurance doesn't see value in that. And I honestly believe it's because insurance only is going to make money if you stay sick. So I like to try to heal you from the inside out. And so the holistic portion of what I do and the sexual health portion of what I do, I think sets me apart. Now, you were asking more specifically about the hormones. So I do not typically use just oral hormones except for progesterone. The estrogen, if you are in menopause and your symptoms and lab work indicate that we need to supplement with estrogen, I usually use a patch, and you just change that twice a week. And I have several compounding pharmacies I work with, or I can just send it to your pharmacy if your insurance will cover it. Then for the vaginal estrogen, or estradiol specifically, there's 3 different types of estrogen in your body, and estradiol is the one that you really want um, for this type of stuff. And it's a cream. So if I have someone who, I gave them the vaginal tablets or the vaginal cream already, the one that they put inside like a suppository, but they're still having itching or burning, like in that clitoral fluid area or like on the labia, I will just give them a tube of estrus cream,
So that's
and
from
they can
dryness,
just.
is it?
Yes, it can be. It's from all that atrophy because they don't have any of that estrogen to help plump up all that tissue. So you can
Okay.
just use like a pea-size amount and you apply it to that area, and
Sounds
it will improve very quickly.
What
And
relief that must be.
yeah, I mean,
Mhm.
can you imagine your
I
your
can.
your downstairs is always itching? You're like, oh, it's,
I
you're just
can.
wiggling in the chair.
I mean, even when you get a yeast infection, and thank goodness I don't get them often. And I've
Yes,
only had a couple in my life, but that
right.
itself,
It
imagine
is
dealing with that all
miserable.
the time. Mm.
Yeah. So the vaginal estradiol is either a tablet or a suppository, or most people don't like the cream because it kind of feels like that yeast medicine, that cream that we used to have to do
Oh yeah.
forever ago. And it's like messy and it goes everywhere and it feels like it's just, ugh. So most people just prefer to do the pill. So the first time when you first start taking it, you do it every day for 2 weeks, then you switch it to just twice a week. So
Wow.
the patch is going to be twice a week, and that vaginal tablet will be twice a week. Now, progesterone, when you take it orally, it's fine. You take it at night because it does tend to make you a little bit sleepy. The main side effect with progesterone is constipation. So I tend to start on the lower end of the dosing and go up as needed. And then the testosterone, you have several different ways that you can do that. I usually just use the cream There's also injections. Most men tend to use the muscle, it's an IM injection, or there's a pellet that you can do. Now, I am not a big fan of pellets because I am a go low and slow kind of girl to minimize side effects. If
Right.
you do pellets, you are going to get a good reaction. However, it's like you have one really good reaction and it's almost like you can never get back to that same good
So what's a
reaction.
pellet? Is it a tablet?
It's like a little pellet. It's like a little small pellet, and they use a trocar to put it in your hip. And what
I
happens is
see.
it slowly, or like the bottom part of your back, it will slowly release over 3 months, 3 to 4 months.
I see. So it's like
But
a
the
slow
problem,
release implant,
it
or
is.
yeah.
It is. It's a slow, very similar, I guess, to, I don't know if y'all have the implant that goes in your arm. It's a birth control.
Yeah, I've heard of that.
So, but it's a slow release. But if you have a reaction to it, I can't get it out.
Right.
Bro, you just have to suffer through it. Bro, I know some people swear by them and love them, and that is completely fine. But like I said, low and slow, try to prevent you having a bunch of side effects and still get the relief and feel good for the rest of your life, not just those first 4 months when you get your first one. Does that answer your questions?
Yeah, absolutely.
Okay, good.
Absolutely. And then, I mean, I'm aware that we're talking in two different, very different countries and healthcare systems.
Yeah.
So I am going to look up later some of these clinics, in my area and around Australia. 'Cause, I mean, I'm sure they're here. And
absolutely.
I'd be keen to know, what the model looks like and how accessible it is. And, because like you said, you don't work with insurance. So
No.
does that make it very expensive for people? And again, I know that the insurance and healthcare model in the States is very different to Australia. So I want everyone listening to keep that in mind. And I will
Yes.
gather some information on that to make it more relevant to our Australian listeners. But what can you speak of that to anyone listening in the
Sure.
States?
So I have had so many people come to me because they have already gone to see their OBGYN or try to see their primary care doctor and use their insurance and go through that process. But it is fighting it. You have to fight insurance companies so much to get everything covered. And then they won't cover the stuff that you actually need. So you end up getting a substitution and it's just not as effective. So seeing me, you do have to be willing to invest your time and your money. So I ask women when I see them for the first time, are you ready to put you first?
Yeah.
Because it's really a lot of times it's the first time that women have put themselves first in their whole life. So
Especially
when
if
you
it's the first
initially,
time they're having the conversation,
yeah.
you know?
So when you initially come to see me, it costs $400 and that includes all of your lab work. It's an hour-long visit and it includes your physical exam. I'm going to do a complete head to toe physical, draw all your blood, check your vitals, and I will do a pelvic exam if you're having sexual health issues. And my pelvic exam is going to be different than probably anything you've ever had before. I do like explaining and talking about your body and saying, hey, you see this part here. Do you feel this here? And they're like, oh, yeah, I've never had an exam like this. So it's not weird, I promise. It's just very educational.
Yeah.
And then that also includes your treatment plan visit. So you come back with me usually within a week. And I will explain all the lab work and what I plan to do with you. And then you have different levels of packages that you could work with me. So again, you're going to see me once a week for 16 weeks. That's going to include all your lab work, your hormones, your medications. And if you're not having to use prescriptions, if we're just going to do supplements and health coaching and life coaching, it starts at $14.97. And then if we're going to have to do the prescription,
oh, wow.
And then you can do if you need to do the prescriptions, then that's going to be, it's more expensive because those medications cost more. So that's going to be $24.97. And then the biggest or the most expensive package is what I call the Lux package. It's for people who need me a lot. So you have my Voxer, so you can contact me multiple times a week if you need to, or if you're struggling with stuff. And that's going to be $54.97 because I can't have too many of those clients and have teenagers and a husband and 2 dogs, 3 cats, and 4 fish.
Yeah. That's a lot. It is a lot.
Yeah.
I mean, that sounds like really great value for money. And I am conscious that it is an investment, and it is something that you need to sit down and consider. can I afford this and is it worth it?
Hmm.
Am I willing to make, in some cases, some cutbacks to put this
Yes.
first? But I can imagine if you're experiencing those symptoms, you're pretty damn likely to cut back in other
Yes.
areas to get
And
that
I will
money.
tell you, I have not had a single person come back and say it was not worth it. I'm
Mhm.
like, I have helped a woman. She knew that she probably needed to retire. But when we started to identify her stressors, she realized that her work was a big part of her stress. So then, she and I talking facilitated her talking to her husband, and she decided to go ahead and retire. And she
Wow.
is the happiest she has been. She's lost, I think, 35 pounds.
Good for
She
her.
is, she's having great sex. She's getting to see her grandkids all the time. And she feels like a whole new woman. And I can
Yeah.
just tell you story after story after story of women who they've basically taken control of their life and changed their life. We talk about boundaries and meditation and yoga, and I just help empower these women to live their best lives. So it's
It
just
really
a wonderful thing.
it really does. It does sound to me like, your best friend because again, I go back to just seeing the doctor and, because you can go to the doctor and get, hormone replacements and things like this, but that
Mhm.
you don't get the extra, you don't get the follow
No,
up, you don't get
yeah,
you just get the blood work and the results sent to you and it's good
yeah,
or it's bad or you need more, or you need less. And
yeah,
it's about that connection, I guess. And I really think a lot, and it sounds to me like a lot of the benefit these women are getting aside from the physical is just that sounding board of having this
yes,
conversation and the education that I'm sure they're
yes.
getting on, yeah, sex doesn't have to hurt, you know?
Yes. And then I have women who don't know if they've ever had an orgasm. I said,
Yeah, well,
sister, we are about to figure some stuff out.
mhm,
Okay. I have
yeah.
resources for that. So I also I keep sex toys in the office, not to use. Okay.
Mm.
Please don't think that. But I sell them so
Yeah.
people can feel comfortable. They're like, well, what is that? And I'll say, oh, we'll have an example right here. You can feel it and
Mhm.
you can touch it. And
Yeah.
then there's an amazing website. It's called omgyes.com. So if you have never, if you're not sure if you've had an orgasm, you're not sure about what is squirting, what is all this stuff, what is it, or vaginal orgasms real? Where's the G spot? This website will help you so much. And it is paid, okay? But it is a one time thing. You only have to pay one time. They even have videos that show people techniques for masturbation that are not pornography. It's
Wow.
like funny,
It's
just
educational.
informative
Yeah.
videos that you and your partner can use to explore your sexuality even more. So it's just, and I will tell you, the biggest sex organ right here, the
Yeah.
brain, especially for women. We will be having sex in our own head, sometimes making grocery lists if it really isn't good sex, and
Yeah.
sometimes thinking, oh, I want to come, oh, I want to come, oh, I want to come. And you're so focused on it, you can't do it.
Yeah.
So it's about learning to let go. And because again, people don't talk about this, people aren't comfortable talking about it. When I finally say, hey, are you wet? Have you done this? And they're like, wait, what? We can talk about this? People
Mm.
just start talking and talking and talking.
Yeah. It's still so taboo in a lot of,
Mhm.
cultures and just areas of the world. And
Especially in the deep South, the religious
mm,
Christian deep South. And I am a
yeah.
Christian, but God made sex,
Yeah. Mm,
you know?
absolutely. It's a very
Sorry.
natural, important part of life. And it
Yes.
makes life, you
Yeah,
need
it
that.
literally makes life.
Yeah.
Yes.
Yeah, I think it's really important to get the conversation going and just take the
Yeah.
awkwardness out of it, And again, you
Yes.
think back to I'm very
We
open
all
and
do
I
it.
don't mind talking about anything.
Yeah.
But I definitely have grown up and come across people who won't even talk about it with their partners.
I
You know?
know.
They
I feel
just
so
don't
sad.
have the
Yeah.
conversations. Mm,
I feel very sad for those people. I really
yeah.
do. I will tell you, especially here, the religion that I grew up in, it was very shame based. We
Mm,
did not have good sex education in our school system here. And I feel like there's so many people that it's just ignorance. They just don't
mm,
know. And if your family is the one that doesn't talk about it, how are you supposed to learn? Well, most people
yeah.
learn from porn. Porn is
Yeah.
not real.
No, it's
Okay.
very
And porn is
unrealistic.
a poison to a marriage. So
Mhm.
until you become comfortable and can talk about it, and that's what sex therapists do a lot of times, or your regular therapist. So I mentioned earlier, I have a lot of resources. Marriage therapists, marriage counselors is another resource that I have because it's something that is hard to talk about if your family of origin didn't talk about it and it wasn't comfortable for them. So,
Yeah, absolutely. I'm just thinking back as well when it comes to sex education. I mean, we were in grade 5 when
mhm.
we had sex education. So we
Luckier.
learned well, and I mean, and it wasn't
It wasn't
I don't think it
details,
taught us a
probably.
lot. Like
Yeah.
it taught us body parts, and
Yes.
I already was very familiar with my body and
Mhm.
what a man's body was. And, I thank my parents for that, for
Yeah.
being open to conversation. I'm aware that most people, or well, not most, but many people don't have that.
Don't have that
But
openness at home.
there, the teacher was awkward teaching it. She didn't, no fault of hers.
Yeah,
It
she's just
wasn't
she got
something.
assigned to this. This wasn't a
Yeah,
passion for her.
and yeah, and you know what? She was actually I am fairly confident that up until that year, she taught kindergarten. So, I mean, she was not wanting to talk about penises and vaginas and to a bunch of
Wow.
kids.
Yes. Poor
And we
babies.
we were taught how babies were made in not great detail.
Mhm.
We were never taught about consent, really. And that was it, I think. I mean, that's all
Mhm.
that's all that left a lasting impression on me. And the girls were taught a little bit about period health. I'm pretty sure the boys, unfortunately, were allowed to skip that lesson, which is appalling to me because
Yes,
all
it
these
is.
boys are growing up to have, well, most of these boys are growing up to have girlfriends or sisters or
And
mothers
marry
or
women, right?
women.
And then
Yeah.
they're clueless.
Mm.
I I have helped my husband become a feminist through all of my education. And my poor little boy, he's 10. And October is Breast Cancer Awareness Month.
It
So,
is.
not this year, but last year, I was doing a talk on breast cancer awareness and I wanted to have a model there. I could not find a breast cancer like model for people to feel on that was less than $250. I said, well, that is stupid because on
Mm.
Amazon, you can get these little stick on breasts for like $20. But no, so I bought them and I turned them around and I opened the back, like I just cut it open and I would like put a marble in there or put some other
Oh,
stuff so you
yeah,
could
yeah.
feel what a tumor would feel like. So, and then I would sew it back up and I just have them because I was working
Yeah.
on it for a few days. I have them on like in the living room. And Nicholas said, Mama, I've got a friend coming over. Can you please put those things out?
With the breast
Yeah.
away.
Yeah. Yeah. So he's very aware, but he
Yeah.
hates it. He doesn't
Yeah.
want to talk about it. If I
Mm.
try to bring anything up, he said no. He just says no and walks away. Nope.
Mm.
Walks
So
away.
how old did you say
But
he is?
he's 10, almost
Yeah.
11.
That's fair
So,
enough. But he'll be
you
very
know,
grateful for that openness when he
eventually.
gets older. Yeah.
Now, my daughter, she said that with her sex education class, they really just taught them about STDs or sexual STIs, sexually
Oh,
transmitted
yeah.
infections, and they tried to basically terrify them.
Mm.
They did teach them about birth control, they and STDs, but not really much else. She said,
Yeah,
"Mama,
well,
I was telling the girls about their hormones and about like their periods. Nobody else really. The class
yeah.
wasn't about that. Of it's just sad.
Mm. It's
Our
disappointing.
education is not where it should be.
Mm. And I don't know how it is now. I'm just thinking about a couple of kids, boys, what they've recently learned last year. They were in year 7. And I don't know if that was their entire component on sexual health. It really, from what I saw, it focused a lot on consent. It was huge. This
Well,
is an all
that's good
boys
because I
school.
don't think they did here.
Mm. It was a big part of it. And it went into detail about how babies are made and
Good,
the body parts and the internal organs and all that. It wasn't
good.
just penis, vagina, sperm. It was because that's what I learned. Now,
Yes.
I can't speak to what the girls were learning.
Yeah.
The boys actually did learn about menstruation and
Good.
were required to know the symptoms and how
Good.
body changes in both women and men. So in comparison to what I learned, I think it's come a long way. Again, I
Good.
went to school in Canada, so perhaps it's
Mhm.
also changed there. I'm not sure. But yeah, as I'm reflecting now on this particular section of the course, it seems like they did learn a lot more than they were even given scenarios, and they had to determine if it was a yes, no consent situation.
Wow,
And some
that's
of them were very
good.
gray. They were some very gray areas. And I could,
A lot of
where it
people put
seemed like it was
the
consent, but it certainly wasn't. But it was meant to kind of give them these scenarios where
yeah.
you might be in this situation and you think what you're doing is okay and it's not. And I really was quite
I
pleased to know
appreciate
that they were appreciating that. Yeah.
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 So my daughter will have friends over and they kind of know at this point that they can ask me anything. And one thing that I always let them know is even if you don't have a condom, I said, you can get herpes in your throat.
Mm,
Okay. You can get HPV in your throat that can cause throat cancer. So just like y'all, condoms, condoms, condoms.
yeah.
And I don't want them having sex right now. They're 16. They're too young to me to be having sex and making decisions that can affect the rest of their life. But
Yeah, absolutely.
please don't go in uneducated and ignorant about it.
Absolutely.
So,
Knowledge is power.
yes, I agree. And that's why I teach all the time. I teach my clients. I teach my
Yeah.
poor little boy who's not even wanting to be taught. And I
Yeah. He's going to be very
whoever will listen
appreciative. Mm.
eventually.
As will his future partners, I'm sure.
I know, as I hope his wife will be in the future.
Yeah. Well, Amanda, thank you so much for joining me today. I really appreciate you being open to talking about all things women and sexual health. And I'm sure we'll stay in touch. I'd love to have you on again. I think there's a hell of a lot we can talk about.
Yes.
And
And
I
I
think
would love, like, if any of your listeners would like write in, what do you have questions about? Because I love to teach. And if
Yeah.
there's something specifically that you're interested in, let us know because I'll come on and talk about it, especially about
Absolutely.
sexual health. I do have a libido class I'm doing tomorrow because I have so many women that are reaching out saying my libido is low. So I'm trying to kind of educate them. So if there's questions that you have, please email us. My email is amanda@vivacious.healthcare. So that is VIVACIOUS.healthcare, not .com. That is the end of it. And I would be happy to answer any questions you have. If y'all are in the States, if you're in Louisiana, of course, come see me. If not, I have a wonderful network of like-minded professionals all over the States. I have a co-op that I'm a part of. Well, it's not a co-op, but it's a group that I'm a part of with other providers that are very holistic minded, and we can refer out to other people. So just let me know.
Yeah, and what I'll do as well, I'll get to the email and I'll get Amanda to share some links with me. And I'll pop those in the description so that anyone
Yes.
listening and who would like to know more information or get
OMG,
taught.
yes. Oh no.
Yeah, I'm going to share all of that. Yeah. I've written it all
Probably the
down and I'm going to,
shot. Yeah.
yeah, we're going to
Yes.
share all that with you. So you'll have
Good.
all those resources there and get ready to talk about your sexual health and start to
Yes.
make it, something that you can be comfortable with. And
Yes.
as Amanda said, if you have any questions, email her. If you would prefer to just comment on the video, do that, and I will make sure the questions get to Amanda. And just thanks for joining us today. Thank you, Amanda,
course. Thank
for
you so
educating
much.
us. It's been very informative, and
Good.
as always, when I have someone on the show, it's got me excited, and I'm going to do a lot more
Good.
thinking about my own health. And
Good.
I'm very appreciative for that. And
I'm
so
glad.
anyone, if you're listening and you like the show, please, I would love it if you'd like and subscribe. Leave your comments for, as Amanda said, anything else you'd like to hear about, either from Amanda or from me. And that's it for this episode. So thank you so much. And I hope you have a
Thank
lovely
you.
day.
You too. Bye-bye.
Thanks for joining me on the Holistic Health Show. If you enjoyed the episode, subscribe now and get ready to embark on an incredible journey toward holistic wellness. Until next time, be well and stay holistic.